All righty, we are going to get started, and we're going to talk about everything you want to know about the COVID-19 vaccine. There are a couple things in here about COVID-19, just for some people who are joining us for the first time. So it's always a mixture of new slides and some old slides that have some basic information that I want to make sure that everybody gets up to speed with. My name is Dr. Valda Crowder. People call me Dr. V. I'm an emergency medicine physician. I've been so for 30 years now, and all of these presentations are actually recorded and they all have the date on them. So if you see a presentation that you want to go back and check out or whatever, you'll actually know what date it is. The source documentation for this webinar is at AskDrV.us, and you can follow me on Twitter at AskDR_V. All right, so the structure of this webinar is 20-25-minute presentation followed by Q&A. We normally end right around 9 o'clock. Now, everyone in this presentation is on listen mode. If you want to ask a question, you can type it in before the presentation is over. You can type it into the chat, or you can type it into the Q&A. Try to provide as much details as possible, and I go back and forth between the Q&A and the chat and answer whatever questions. The goal here is that we all have real life decisions to make in real time. So this presentation on Tuesdays and Thursdays at 8 o'clock p.m. at 9 p.m. is a space where you can actually ask the questions you want to ask, or if you have things that are upcoming and you don't know how to handle them, you can ask those as well. All right, so let's get started. The intention of the webinar is to keep webinar participants informed about COVID-19 science that will help them and their families stay safe during the pandemic. The outcome is to create or improve an action plan for you and your family. Or you may be creating or improving an action plan for a broader community, maybe a church or a union or a business, etc. All right, so to date, we've had 527,000 people die from COVID-19 in the United States. So that is the number for in the United States. That's similar to the entire population of Miami, Atlanta, or Baltimore suddenly being gone in a year. So also similar to the number of people that died in the World War I and World War II combined. Today is the 1-year anniversary that the World Health Organization publicly declared COVID-19 a global pandemic. So it is exactly 12 months from that time. And I want to really, give kudos and thanks to everybody on this webinar, because we have really worked together to keep our families and our communities safe. A lot of you have been a beacon of knowledge and information for all the people that you contact. And in a year, I feel like this community has really done a lot to make a difference in a positive way. So I really want to thank you for coming on here and participating, asking your questions, getting flat on all the details and all of that. As you can see, from a year, we've learned a lot about COVID-19. When it first started, we knew much, much less, and we will continue to learn as we stamp this out. Globally, there's been 118 million cases and 2.6 million people have died. And again, the cases in the US are about 29 million with about 530,000 people dead. A lot of nurses are traumatized and tired and quitting during the pandemic. This is unfortunate because we really do need that capacity there, and we do need that workforce there. But it's very hard, when this has been going on for an entire 12 months and there really hasn't been that much of a break. In Idaho, we saw some families and kids burning their mask. I think it's really too early to burn your mask or get rid of your mask or even remove any state mask mandates. In Texas, the governor did lift the mask mandate and is allowing businesses to operate at 100% capacity. As I always say on this webinar, you still have a choice to do what you want to do and take the precautions that you need to take. And if you feel that a restaurant or a business is too crowded, leave. This is unfortunate. The Texas Attorney General, apparently Austin, wanted to keep their mask mandate. So now the Texas Attorney General is threatening to sue unless the Austin leaders rescind their mask mandate. So, you have a lot of still, people trying to tell folks what to do around mask mandates. And really, if a community, a city or a township wants to keep their mask mandate, they should be allowed to. When Texas had the power outage, there was a lot of people recovering from COVID-19 that needed oxygen. They may have needed CPAP. They may have needed the nebulizer machine. So I just remind people that, power outages, whether or not they're related to a snowstorm or a hurricane, really do impact a lot of people seriously. The CDC is really urging people to still be careful at gyms. Gyms were a major source of COVID-19 outbreaks, and they had a recent outbreak in Chicago and Hawaii. So they're just really suggesting that people still be very careful. I want to thank Kroger's, Starbucks, and Target. These are all retailers that have said they are going to require masks despite the end of state mandates. So we appreciate you guys for helping us stay healthy. Similarly, this is a photo that I took at a Gulf gas station. And they were reminding us to wear gloves or use a paper towel when pumping gas for all touch points on the gas pump. And again, this little reminder sometimes is just all you really need to remember to throw on a glove or get a piece of paper towel out of your car and be extra careful when you pump gas. The lifting of mask mandates in Texas actually led to some maskless customers at Trader Joe's having a meltdown. I think that one of the things that is important is this kind of shows why the state mask mandates are so important. Once you lift them, then you really do actually put the employees at these businesses at risk for having to enforce their company policies, et cetera. What we found is that obesity or folks being overweight significantly impacts COVID-19 death rates. It is 10 times higher in countries where adults are overweight. I think that the similar data will actually bear out even for children. I have a lot of concerns about children that may be going back to school that are overweight, because that is also a risk factor in the pediatric population. All right, so let's talk about COVID-19. Highly contagious, 45 seconds is the amount of time that it takes to expose others and infect others. If we're talking about mutations, that 45 seconds can be 15 seconds. When you look at how many people actually get COVID-19 out of 100 that are actually exposed to it, it's 60 to 80%, so it's very high. It's both a droplet and an airborne. The droplets are larger and fall closer to the person that they're coming from, and airborne can go out a lot farther. So this just shows you a photo. If this gentleman was COVID-19 positive, the red is a droplet and the gray is the airborne. Both are infected with COVID-19. The droplets fall within 3 feet, and the airborne particles can go very far and stay in the air very long. It really depends upon the temperature and the humidity. When it is less than 52 degrees, these airborne particles stay in the air much, much longer. Testing. PCR test is the gold standard. That tests the genetic material of the virus on the nasal pharyngeal swab. That is also the test that's most uncomfortable. It's most accurate 8 days after exposure, and it can be inaccurate if it's too soon or too late. The antigen test, which is the rapid test, gives you a false negative about 30% of the time. Now, what that means is it tells you that you're negative when you really do have COVID. So again, the rapid test can come back negative 30% of the time when you really do have COVID-19. So if it's positive, if it's positive, it is true. If it is negative, you probably need another one. Mask, I want to talk about masks. I'm encouraging everyone to upgrade their mask. The fabric masks there are 20 to 30% effective. The surgical masks there in the upper right are 25, 35% effective. The KN95 mask is the one that you actually want to get. Honeywell actually just restocked this. If you go to the Honeywell website, I think there's 20 masks for about $30. That mask is 80 to 90% effective. The Spirion half respirator mask on the lower right-hand side, that's actually what I use in the emergency department when I actually see COVID positive patients. A lot of people say the masks are uncomfortable. I just remind people this is what it looks like when I intubate someone and put them on a ventilator. It is extremely uncomfortable. There's a metal laryngoscope that we use to go down the back of the throat so we can actually see the vocal cords and actually pass the tube into the lungs and then connect someone to a ventilator. So let's talk about the symptoms. The number one symptom is no symptom. So remember, people who have COVID-19 do not have to appear sick. Someone who is healthy can have COVID-19. Now, when people do have symptoms, it's flu-like without a fever, flu-like with a fever, or gastrointestinal symptoms, which is vomiting and diarrhea. These three clusters, you're usually self-limited and they resolve themselves at home. Cluster 4, 5, and 6 are the ones that normally have to come into the emergency department. They have to be admitted, they may go to the ICU, and they may pass. Those are people with fatigue, confusion, or a combination of abdominal and respiratory symptoms. COVID TOS is reddish blue discoloration of the extremities. It's particularly prevalent amongst kids. I have seen it in adults as old as 55 years old, but this is COVID-19 until proven otherwise. Now let's talk about the patient outcomes, because people most commonly think of COVID-19 as far as if you live or you die, but there's a lot that's in the middle. So some people actually do catch COVID-19. They're asymptomatic or symptomatic, and they completely recover and they never develop some symptoms again. That is the best possible scenario. Then there's people who catch COVID-19, whether or not they're symptomatic or asymptomatic, they recover, but they develop symptoms later on. They're called long haulers. Some of them have shortness of breath. Some of them have problems concentrating. Some of them have loss of balance, any number of things. Then you have people who catch COVID, they recover, and then five or 6 months later, they catch it again, which is a reinfection. That reinfection sometimes can be worse. Sometimes it can be milder. You just don't know, especially with all the mutations that are going on. Then you have folks who catch COVID, they become seriously ill, they go into the ICU, and they have what we call post-ICU syndrome. So post-ICU syndrome is where 75% of the COVID patients come out. They have cognitive, mental, or physical impairment. They may have renal failure because of dialysis and require dialysis or transplant. They also can have limb amputations, strokes because COVID-19 causes a lot of clotting. 50% of the young patients are not able to return to work. And then they can have pulmonary scarring or decreased lung capacity. We've already had to do several bilateral lung transplants in COVID patients. I just share the story. You know, an Idaho man thought the COVID virus would disappear. It did not. And he is a long hauler on COVID and will need oxygen for the rest of his life. So I just remind people that, you know, we can't just wish it away. I wish we could wish it away, but we can't just wish it away. So we really have to stay vigilant. Researchers have found that there's a higher concentration of coronavirus in the brain than in the lungs. So that's why we're seeing some of the problems with balance and concentration. Now, if you found out you're COVID positive, you want to immediately quarantine. 14 days is what the CDC recommends, preferably 21 days. There's about 7% of the people that are positive even after the 14 days. You want to purchase a pulse ox, which is the thing to the right. It's about $30 on Amazon. If you go to the emergency department, some emergency departments or clinics will give them to you. The first number on there that says 97, which says SpO2 97, that is the hemoglobin saturation. You want that to be 94, 95% or above. The second number is your pulse rate, and that's really not very important for determining how sick you are. When you have a fever, your pulse rate will go over 100. As long as it's less than 120 or so, you're probably fine. Everyone now should be taking zinc and vitamin D3 because deficiencies of zinc and vitamin D3 make a difference. So everybody should be taking zinc and vitamin D3. You want to have access to a bathroom that's only used by you, a cell phone, if people can leave food at your closed door, and you want to open up the windows and also possibly put in a HEPA filter or improve the filtration in your HVAC. Treatment. So COVID treatment is oxygen, vitamin D and zinc, if you take that beforehand, famotidine, which is Pepcid AC. So Pepcid AC is something else that you can get and put in your bathrooms at home and have access to if you get COVID-19 positive. Decadron is used in a hospital setting to decrease inflammation. And then antibody cocktails. This is the most important thing. While everyone is waiting to get vaccinated, should you actually catch COVID-19, it is very, very important that you actually know where you can get antibodies. Antibody cocktails, the monoclonal antibodies, decrease the amount of hospitalization by 70%. And then people who actually are on ventilators and don't do well, sometimes if they're young, they'll also put them on ECMO, which is like a heart and lung machine that is outside of the body and oxygenates the blood. So one of the things you want to do is know where is the infusion center near you. This is a screening tool for the infusion centers. Anyone over 65 years old would actually qualify. Now, people between 12 and 64 qualify if they have diabetes, heart disease, or on immunosuppressive disease, or even if they're a little bit overweight. What's important about the monoclonal antibodies is you have to get them early. So you have to get them for this screening tool. It was within 10 days. The institution that I work at is within 9 days. So I remind people, please, please do not stay at home with symptoms and try to tough it out. You really want to go in and get the monoclonal antibodies. It really makes a difference. Once you catch COVID, you have immunity for about 5 months, 3 months for sure, and then between 3 and 6 months, it starts to wane. Now, let's talk about the vaccine. I show this to show how this virus works. The virus is inside a fatty coating, the viral RNA, and the fatty coating is the darker orange, and it has spike proteins. The spike protein connects with a receptor protein on the surface of the cell. That is how it gains entry into your cells. Then once it gets inside, it begins copying and copying and copying. It copies, the RNA tells it to copy, and it makes other copies of itself. And it makes copies of not only the virus, but also the fatty coating outside and also the spike protein. It reformulates and it heads back out, and then it actually attacks another cell. So it does this over and over and over and over again. You have over 1 trillion cells in your body. So when you hear people who've had COVID, a lot of them will say, I felt like my whole body was on fire. And this process is happening over and over again and causing inflammation throughout the body. So Moderna and Pfizer is a messenger RNA approach, and it's coded for the spike protein. You get vaccinated, you produce the spike protein, your body sees it, says, hey, I recognize that as foreign, they develop antibodies, and it kills it. So now when you see COVID-19 in the regular community, you actually know how to your body knows how to fight it off. Johnson & Johnson is what they call a viral vector approach. It takes an adenovirus, which is the common cold, alters it so that it's harmless, connects it with some genetic material from COVID-19, and that combination teaches your body to create antibodies to the spike protein. And again, so the virus cannot attach and COVID-19 will be rendered harmless. Now, these are all the vaccines and all of the different protocols that are going on right now. Just want to actually just go through. These are the 3 in red that are actually approved. I think that the next one that we will see approved will either probably be Novavax or the Janssen. The Janssen is 2 Johnson & Johnson shots, but it's the same shot as Johnson & Johnson. The goal is to see whether or not 2 shots will be better than 1. So we have Pfizer and Moderna, which are both 2 shots. The only difference is whether or not it's 21 days or 28 days apart. Johnson & Johnson is 1 dose. The 72, 96, and 57. 72 is the effectiveness in the efficacy in the US. 66 was the efficacy in South America. And 57 was the efficacy in South Africa. Now, what's important, people look at this table and often say, well, Pfizer and Moderna must be better. Pfizer and Moderna did not test during mutations. So right now, what we know is that both Pfizer and Moderna seem to work on the UK variant, but they are not as effective on the South African variant. And both companies, Moderna and Pfizer, are right now investigating a booster. People ask me, what's in the vaccine? Here is what's in the vaccine. This is what the FDA has listed as the contents. So I just shared that with everyone. You're welcome to take a screenshot of it if you'd like. People ask me if ethylene glycol or antifreeze is in the COVID-19 vaccine. The answer is no. What's in there is polyethylene glycol, which is also in lotions, creams, and toothpaste. And this helps the vaccine evade the immune system and stay in circulation longer. Now, I've gotten this question, and these are some slides that I've added based upon everyone's request. Understanding the difference between DNA and RNA. So first of all, DNA is a double-stranded molecule. It is the molecule that makes up your genetic, everything about who you are is made up by DNA. RNA is a single-stranded molecule. Now, I want to just show a little bit about, this is very important. DNA is self-replicating and it can replicate itself. RNA comes from DNA as needed. So it's important that people actually realize that RNA actually comes from DNA, but RNA cannot actually change DNA, okay? Now, what can change or damage these molecules? So DNA actually is damaged when there's ultraviolet light. RNA actually is very resistant to ultraviolet light. So what does this mean? The COVID-19 vaccine does not damage your DNA, but tanning beds do. So I want to make sure everybody understands this. Also, extended time in the sun. All right, some people ask, well, the COVID vaccine was developed so quickly. Can we really trust that it was developed in 11 months? Well, it actually wasn't developed that quickly. In 2002 is when we had SARS infection. It reached 33 countries and it caused 810 deaths. Immediately in 2003, vaccine development began for SARS. Now, this is an article from 2005, and this is where they actually talk about a spike protein and the importance of developing either a messenger RNA or a viral vector approach to a vaccine. And that is what they did, and they developed a SARS vaccine. Now, it happened to be that we got a pandemic. SARS and COVID-19 are very similar. They both have spike proteins. They both have severe respiratory symptoms. And 80% of the DNA is the same for SARS and for COVID-19. So this is kind of how we were able to actually move really quickly and actually take what we had already learned and actually developed and take the SARS vaccine and actually amend it and actually have it work for COVID-19. Now, let's talk about the mutations. Today, the $1.9 trillion bill was actually signed by the president, And we will hear a lot more about mutations in the coming weeks. So the main thing is we have not been doing genomic surveillance in the United States. So in that $1.9 trillion bill is money and funding to do genomic surveillance. So part of what we're going to be talking about in the future is how much of these mutations are out and around. So we don't know the answer to that because we haven't been doing that work, but we're going to start doing that work now that the funding for it just got approved. Now, of the mutations, there's the B117, which is a UK one. That one really seems to be pretty much controlled by the Pfizer and Moderna vaccine, and also Johnson & Johnson. The one that is a concern is the South African variant. The South African variant has a lot of alterations to the spike protein. So the spike protein is quite different. In addition, it is more dangerous for children. So again, this is very concerning with some schools going back. The vaccination is not as effective against the South African variant. It is really, really important. And then we have the Brazilian, California, and there's a New York variant. So it is very, very important, even after you get vaccinated, to still wear a mask if you're, in public spaces like grocery stores and things like that. This just shows there's a vaccine evading mutation that they're actually seeing in New York. All right, and this actually is the information where they're saying that Pfizer and Moderna could be far less effective against the South African variant. And again, I think that's why Johnson & Johnson's numbers don't look as good as Pfizer and Moderna, but really, I think they really could be fairly equal. All three vaccines, Pfizer, Moderna, Johnson & Johnson, protect you from serious COVID-19 illness. And I tell everyone, get the first vaccine you can. So far, we've distributed 95 million vaccines. We have 10% of the population that has been fully vaccinated, and we have 20% of the population that has at least had one vaccine. So we're now moving at a very fast clip. There was an announcement today that by May 1st, every adult that wants a vaccine will be able to get a vaccine or should be qualified to get a vaccine. We're now doing almost 2 million vaccinations a day. Merck is going to help Johnson & Johnson with manufacturing. So this is great to see these two rivals actually work together to really help with getting this public health crisis under control. Just wanted to show you a couple websites. This is what it looks like to get your to sign up in Maryland to get your vaccine. California is myturn.ca.gov. That is where you should go. Now, they've also sent the vaccines out to a lot of different retail pharmacies. CVS, this is what the website looks like for CVS, and also Walgreens. And this is a website for Walgreens. What's interesting about CVS is they have now expanded and they have added 12 more states. So if you did not think that your state was included, this actually came in the news today. So they've added 12 more states. In addition, they also announced that they're going to actually be working with Target so they can use the dressing rooms in the Target and actually vaccinate people in Target. So CVS and Target are also going to be working together. So if you thought that you did not have vaccines in your state at CVS, I would reach out tomorrow and ask again, because this is hot off the press information. There's also vaccinehunter.org and vaccinefinder.org. Both of these websites have a setup where they can actually give you some tips on where is the best place to get vaccinated. Vaccinefinder.org is backed by the CDC. Vaccinehunter.org is a private organization. And basically you have people that, sometimes don't show up for appointments, or they have more doses in the bottle than they expected, and they don't want to throw things out. During the Texas power outage, there was lots of vaccines that they were going to lose, and they were calling people left and right and just getting them vaccinated before they lost them when the refrigeration went out because of the power. So, should you get vaccinated if you have a weakened immune system? CDC says yes after consultation with your PCP, your primary care provider. Autoimmune disease is the same thing. Yes, after consultation with your primary care provider. For Guillain-Barré syndrome, if you've had that before, or Bell's palsy, the answer to that is also yes. Now, pregnant and lactating, it was not studied. It has not been studied in pregnant and lactating women. So I think there are some studies now that they're going to do, but what they have found is that the vaccine does not cross the placental membrane. So because women that are pregnant are at increased risk for viruses, some OBGYNs are really recommending it. So what the CDC says is consider it after consultation with your OBGYN. And then G6PD deficiency, yes, after consultation with your primary care provider. Now, what does it look like when you get your vaccine? So basically, for the first 2 weeks, if you're getting the Pfizer or Moderna vaccine, you really don't have any immunity for the first 2 weeks. So the immunity really starts to build after that 2-week period. Then when you get your second vaccine, they're saying that you get full immunity a full 2 weeks after the vaccine. So that is the time period that it takes. In Israel, where they have actually vaccinated a lot of their population, they're now finding almost all the COVID deaths are people who are not vaccinated. This is a race. This is what Dr. Fauci says. We really have to take any vaccine we can whenever it's available, and protect ourselves and our family. Now, when you are fully vaccinated, what can you do and what can you not do? This also came out this week from the CDC. So you're fully vaccinated 2 weeks after your last shot, whichever your last shot was. When you're fully vaccinated, you can visit other people who are fully vaccinated indoors without wearing a mask and not needing to stay 6 feet apart. Also, when you visit unvaccinated people from one other household indoors without wearing a mask or staying 6 feet apart, if everyone in the household is at low risk for severe disease. Lastly, when you're fully vaccinated, you don't need to quarantine or test if you don't have any. If you come in contact with somebody with COVID-19 and you don't have any symptoms, you don't need to quarantine or test. Now, what sort of things can't you do? They're still suggesting that you wear a well-fitted mask and you stay 6 feet apart from people that you don't live with, and that you avoid medium and large size in-person gatherings. Also, they're saying if you actually start experiencing symptoms, do get COVID-19 tested. You can get COVID-19 with the vaccine. It's just you're going to have a much, much milder course of it. Most people never actually have to be admitted. So far, I have not heard of anybody who's had to be admitted who was fully vaccinated. Then follow the guidance of your individual employers. As far as travel is concerned, I tell people I still would avoid it. But there are travel recommendations that each of the airlines has, as well as the countries, because they are not yet actually up and running with vaccine passports. So sometimes they're still making vaccinated people quarantine and get tested, etc. All right, these are some of my COVID-19 shots. Keep the photos coming. All right, and we're going to go to Q&A.